Hi, I'm Cornelia Poer. I'm the social worker at the Duke Geriatric Evaluation Treatment Clinic. We're a consultative clinic for people 65 and older who have a variety of problems, including dementia, which is one reason I've been asked to come and share my thoughts with you today. So communication is worth our consideration when somebody has memory loss because it can make or break the situation. The ability to express oneself and understand is gradually going to change with cognitive impairment, and at times it can feel like I speak French, you speak Spanish, and we live in an English-speaking world, and we have to figure out a way to be able to communicate with each other. So communication problems for persons with cognitive impairment can include repeating oneself, so saying the same thing, asking the same questions, trouble finding the word, it's on the tip of their tongue, but they can't think of the word, can't get it out, using incorrect words, using words out of sequence, not logical or organized, and losing their train of thought. And this can even happen in the middle of a sentence. So how do we deal with those changes? What strategies are out there to think about? Well, keep in mind the rule of personal communication. 58% of what we communicate is body language, gesture, movement. 38% of communication is our pitch, our tone of voice, the way we say the words, and then 7% is actually the words that we use. So when we're communicating with somebody with cognitive changes, how we say it may be as important as what we say. Be aware that feelings linger. Someone with cognitive impairment may not remember the details of what they were talking about, but the feelings that are generated by the communication may linger. Reasoning doesn't work. A person living with dementia, because of short-term memory and thinking problems, are not functioning well, cannot remember what you're telling them. It's kind of like those black wax tablets that we used to use that had a plastic white sheet, and you'd use a stylus and write in on the top of the plastic paper. When you pull that plastic up, the words disappear. So expecting someone to be able to retain what you're talking about and reason with them just will not work. And then, as you can imagine, your frustration in trying to get them to understand what you're talking about can come out in body language that can be misinterpreted or tone of voice that can be misinterpreted. And then that person becomes even more adamant that they're not going to reason out the information with you. Likewise, judgment can be affected by not being able to remember the information, and the person that you're talking to can't retain the information, so therefore they can't make a decision and come up with a good plan. When you're trying to communicate important information, it may be more successful if you pick the best time of the day for that person. So, for example, sundowning or more confusion and behaviors that are associated with that confusion may happen later in the day. So if you're talking to someone and it's late in the afternoon, trying to communicate with them might be more challenging than if you pick a better time of the day for them. Or if they're not a morning person, trying to communicate with them in the morning may not work as well. When you're trying to communicate important information, pick that best time of the day for them. The environment also plays a big role. Trying to have a calm, quiet environment may be more successful, especially if you're in a crowd, let's say a family reunion or a holiday situation. If there are a lot of people there, you may want to take that person off to the side and talk to them one-on-one instead of in a big group. Or if that person's been very upset, you want to wait until they're calmer, or maybe you're the one who's been upset. You want to wait until you're calmer so that you can try to communicate. It may work much better that way. despite behaviors that are often described as childlike by family members. So they're acting like a 2-year-old. And those behaviors are probably related to frustrations on the part of the person living with cognitive impairment, not being able to communicate or do things that they used to do. This person is an adult with adult emotions, and you need to keep that in mind. So even though a behavior may come out like an outburst, like a 2-year-old, that person is not 2. They're an adult with an adult emotions, and you need to try to treat them that way and keep that in mind. Perhaps one of the biggest things that I like to remind families is outline, not paragraph. So we are in a culture that likes to give as much data and information as possible because we think that we'll have better understanding if we give people a lot of information. Someone with a memory and thinking problem, on the other hand, it might be overwhelming. They can't retain all the information. You get frustrated trying to help them have the aha moment. And in doing that, your body language again, or your tone of voice, and maybe even your words, can come across differently than you intended. So just giving the need to know information, not in a disrespectful way, but in a way that that person can get the details or the facts without overwhelming them. One of the daughters that I was working with once said, "Oh, I've been doing data dumping for so long, that's why he's getting overwhelmed, as I'm just giving him way too much information." So try to do the outline, not the paragraph. And then with repetition for patients, family members, and I'm sorry, I work in a clinic, so it's persons living with dementia, repetition can sometimes be just overwhelming. That asking the same question over and over again or telling you the same information over and over again can be overwhelming for the care provider. So with repetition, it's really hard not to say, "You've already told me that," because, in fact, you've already told them that, or "You've already asked me that, and I just answered that question." Try to avoid that if you can. One son said his mother told him, "I'll ask you 10 more times if I want to." So every time he would say, "I've already answered your question," she would come back with that. She couldn't remember she'd already told him, but she could remember she was the mother, and she could remember she had the right to ask or tell him information again and again. So he needed to learn to do things differently. If somebody's doing a lot of repeating, let's say they're asking you the same question over and over again, just answer the question. You don't have to go into a lot of detail. They're getting the information they needed. You're getting the information you want to provide, and you don't have to be creative. Just answer the question, and it'll work better for both of you. Even if you've heard the same story over and over and over again, and sometimes that happens, try to convey interest and pay attention to the person who's talking to you. That person is telling you something thinking it's their first time that they're having that conversation with you, and so they don't realize they've already told you. You probably know the outcome of the story or what they're telling you, so it's important that you still pay attention to what they're saying, or at least they think you're paying attention. I like to tell families sometimes to pretend you're a 15-year-old, because when we were 15 and we realized when our parents were talking to us that if we just said, and they would get finished telling you what they needed to tell you, and you could go on about your business. So in some ways, you want to be that 15-year-old again, paying attention, conveying interest, and then go about your business. Sometimes you can use those stories to your advantage when you're trying to distract somebody by asking you to tell them that story again. If the person living with dementia has trouble finding words, ask if it would be helpful if you fill in the blank or try to guess at what they're saying. Some people appreciate that. Other people get very distracted by it and don't appreciate the efforts. Sometimes people with dementia use incorrect words that aren't logical or lose their train of thought. So, for example, a gentleman in our support group, his wife every day would tell him she would want to vacuum. He would get the vacuum cleaner out, set it all up, say, "Here it is," and she would say, "No, I want to vacuum." And he would try to reason with her and explain that this was the vacuum cleaner she was asking to vacuum. And then it would just go south the rest of the way. So he said it took him a long time to figure out when she said she wanted to vacuum that she, in fact, was not wanting to vacuum. And then he used redirection or distraction by saying, let's go on a walk first. Once they'd gone on a walk, that changed her thinking. She wasn't in the mood to vacuum anymore. He said he never did figure out what it was she wanted to do, but her brain was using the word vacuum when she was trying to tell him something else that he wanted to do. And again, understanding that the person with memory and thinking problems may not have as much to say, so they talk less, is important. So I had a lady who was a public health nurse who didn't want to say the wrong thing. So she just chose not to speak. And that was her coping mechanism for dealing with her memory loss. So she just wouldn't say a lot. You now have permission to take the lead of the conversation if you have someone who doesn't like to speak a lot. We're used to this conversation being a back and forth between individuals, so it feels awkward when the other person doesn't respond or you have to lead the conversation. But you now have permission to do that. And on occasion, there are some people who talk too much. They don't realize that they've already told you something. They don't realize they're talking, they're saying something. So then they will talk and talk and talk, and that can be very distracting to the care partner. So you may want to try other things to distract this person from talking, especially if you're doing something you need to focus on as a care partner. Try music, try some event or activity that that family member can engage in that can kind of slow down the talking or help them get interested in something else. So that might be a strategy. If the person with memory and thinking problems doesn't respond immediately to your request or your conversation, give them time, pause. Sometimes you may even have to think in your head, silence is golden, just to allow them the moment to process that information. It's sort of like they're using one of those old amber screen computers. It will compute eventually. It just takes a little bit of time. Again, a person with memory and thinking problems may forget what they were actually talking about or get lost in the processing. So you can ask the question again or prompt them again, given a reasonable amount of time. So that might be a good strategy to put in place there. Practice patience and reassurance. A daughter in the support group wondered why sometimes she called her father Daddy and other times she called him Mr. Bill. It turns out every time she was talking about Mr. Bill, it was the problematic time of his day, or he was more agitated and irritated and confused. And she would call him Mr. Bill because he really wasn't her dad. When he was her father, when he was calm and doing the things or saying the things he normally did, she would call him Daddy. And so by allowing her to know that was a cue to her own self, that he was not himself, that his memory, the disease, was affecting his ability, then she could alter the way she worked with him to be more calm, to be more reassuring, maybe not to tell jokes that he wouldn't understand when he was more confused, or to ask him, give him instructions one item at a time instead of a long string of activities to do. So she could practice being calm and reassuring, and she actually understood the cue to tell her when I need to do that. It's hard. We're all human. We're all going to lose our temper occasionally or be frustrated. But if you stop and think, why am I getting frustrated? It's probably because it's the disease, and you need to change how you're responding to that person. So practice being calm and reassuring. Keep a sense of humor. This doesn't mean laugh at the person who has a memory and thinking problem. It's all about laughing with them if something that their memory and thinking causes them to do something. like calling a dog a cat when you know it's a cat, a dog, or whichever, and then you get confused and then everybody laughs about it together instead of laughing and saying they don't even know the difference between a cat and a dog. Focus on the feelings and not the facts. We're working in a doctor's office. Many of our patients start ruminating about the appointment. When is the appointment? I heard there's an appointment. Nobody told me there's an appointment. And they can go on and on and on about the appointment. And it's not so much the appointment and the details of the appointment. It's the fact that they have an appointment, that they're going to have a performance or anxiety problem related to the appointment. They want to present themselves in their best manner. They're afraid of what they might hear. So they may ask that question over and over again. So focusing more on the feelings and not the facts may be more beneficial. So you can say, yes, you do have an appointment. It's at 1 o'clock on Tuesday. They may generate more questions by the person with memory and thinking who want to know more about that than answer that question, but you don't have to give them all the information. And if they accuse you of not telling them something, you can say, I'm sorry, I thought I did. Here's the information. So if you're trying to verbally reassure them by what you're saying, instead of just giving lots of facts that are going to be forgotten, because remember, the feeling lingers. And if I've had a conversation, but I feel fairly okay about that conversation, then I'm not going to be so upset and maybe won't ask as many times if I'm feeling anxious and worried about something. So focus on the feelings. Unless it's a safety issue, avoid criticizing and correcting. Use distractions and redirections as needed. You may have to have a go-to phrase. So my go-to phrase is, ooh, let me tell you about this while I'm thinking about it. And then tell them something. It could be about another family member. It could be about a flower you saw in the yard. It could be anything. Another idea is to talk about the weather, especially here in North Carolina. It's always changing, so you can say, I heard it's going to be really hot today and we're going to have thunder showers this afternoon, so we need to make sure we take our walk earlier, or the windows are rolled up in the car, or we won't need to water the flowers. All of that is a way of distracting that individual. You can also remove yourself from the room as a form of distraction. Now, that doesn't mean gather up your things and storm out, because again, that feeling lingers, so they know you're unhappy with them about something, but they just don't know what you're unhappy about. But what you can do is say, I'm going to go to the kitchen and get a glass of water. Would you like one? And then while you're in the kitchen, do your deep breathing exercises to help yourself calm down. Bring them water when you come back, because at this age, we forget to drink. We don't get as thirsty, so we forget to drink. And then bring up another topic. So that's a way of distracting somebody. Now, every time I say that, somebody will say, well, what if we're in the kitchen? Okay, then you can say, I left something in the car. I need to go check on something in my room. I may have left something on. And again, calmly leave the room, deep breathing when you go into the other space, and then when you come back, talk about something different than what you had been talking about. Does that mean it won't come back up again? No, it does not mean that. But it does mean that you may have a brief respite, so you can get that distraction and reassurance. How about just in general, understanding and remembering that it's easier to change yourself than to change somebody else. So with dementia, with people who have cognitive impairment, we have to make changes that will help us with a person that we're working with. Now, some of these things that I'm going to talk about just briefly may seem like, why are you talking about those for communication when we're talking about just talking to patients and using our body language? But consider changing your standards. We don't have to do things the same way all the time. We can make changes, modifications, so we don't have to stick with the way it's always been done. Assume a good enough for now attitude. So we don't have to be perfect. We don't have to be right. We don't have to be strong all the time. But we need to think this is good enough for right now for this circumstance. How about appreciate everyone's ability? That's the ability of the person living with memory and thinking change, as well as your own ability. And arranging to have plenty of time for tasks so that you don't feel rushed, you don't feel hurried. Your body language is not being misinterpreted as we're running behind and we're rushing, but it becomes an interpretation that you're upset with me. So make modifications. If the person takes a long time to take a bath and you have a doctor's appointment, maybe getting up earlier or doing some of that the night before, laying out clothes, those things. Do difficult things at good times of day. We mentioned that briefly earlier. Take breaks, especially when something is very challenging. So I understand it takes about 26% of all our body's energy to run our brain for the regular person. And a person with cognitive impairment, it may take up to 60% for them to run their brain. So they need to rest. Remember in school, taking a 4-hour test, you're exhausted and all you did was sit there. So this is the same thing for someone with cognitive impairment. It's hard to keep our attention, our focus on that person and what's going on. So we need a moment to rest our brains. Share the care. So share that care with other people and let them help you out. So take good care of yourself. Remember, there's support groups. There are exercises that you can do to help yourself. You can journal, see someone for counseling if you need to, and get depression treated if the caregiving role has pushed you in that direction. Remember, we're all in this together, and the changes we make may make a difference in the person that we're helping to provide care for and provide things that will help them to be the best they can be and make our tasks a little easier. Thank you for your attention today. I appreciate it.